Welcome to the Codecast podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the Codecast podcast today. My name is Terry Fletcher. This is the 206th episode of the Codecast, and we have hit a milestone this week. We hit 250,000 downloads. So I just want to thank you so much to the listeners for supporting this platform for the last 4 years. Hard to believe we've been on the air for 4 years. So still going strong. We're averaging about 1,500, 2,000 downloads a week, and we're hoping to increase that much, much more. So thank you very much again from the bottom of my heart. I just really appreciate that. So this is the last Tuesday of the month, and that means Top 10 Tuesday, as you know. And my topic today is going to take us to focus a little more on coder communication. So I want to give you the top 10 tips and practices to be successful at your job. Last week we talked about coding with authority, and there are days when we need to take a breath and step back and regroup. And it kind of stemmed from something I was listening to. As you all know, I'm a football fan, and I also podcast for the Pittsburgh Steelers and for things that are happening around the NFL. But I was listening to a clip of an after the practice media Q&A this week with, and I call him my quarterback because I love Ben Roethlisberger. But I was listening to Ben and what he was saying to the media, and he said something that's been sticking with me all week. And I just want you to hear this because it does apply to what we do as coders. And he said, play for the guy next to you. It doesn't matter that you say, I went out there and did my job today. Of course you did. This is what you're paid for. But if you aren't here to help your team win, then you're in the wrong team sport. And I kind of relate that to being a coder in a coding department, in a practice, even in a hospital. With your coding team, collectively, we have to do this job together. It's more than it's more than just what you do. It's how did you help your team today? And that's hoping what I'm going to give you today as we talk about some of these things when it comes to that communication, because I think that can be lost. Over the last couple of years, coding has been influenced by the transition of not only ICD-10 or to ICD-10, quality indicators. We've now got data analytics causing coding roles to change tremendously. I mean, my first thing, and some of you may not know this about me, I've been doing this for, I'm going to age myself now, 36 years? And I started as a coder, as a biller. And now what do I do 70% of the time? I audit coding. I audit documentation. And so for payers and for practices, mostly practices, but 30% of my business is about auditing for payers as well. So, and then one aspect that has changed substantially is the increased email communication we get with other health information teams. You see how I keep going to that team. The CDI, the clinical documentation integrity folks, the query folks, the Q&A quality assurance, the case management people, related all to clinical documentation and coding accuracy. I just read recently on Becker's Hospital, which is a great thing. If you ever go to beckershospital.com, you can sign up for their newsletters and just tells you all the industry happenings. Very good publication. But they're just talking about how now they're focusing on things that are on the fraud alert, on the refund alert, and things like that have to do with coding, and they're not just provider errors or coding errors. And so the ultimate responsibility is being placed on coders to interpret clinical documentation and apply coding accuracy. And then when questioned, coders should be able to communicate logical answers backing up their assessments. Kind of goes back to what I was talking about with coding with authority. And for many coders, this is actually a new concept. Some may struggle with this newfound communication in relationship to the daily challenges of maintaining productivity. And coders are relearning time management as well. Tell me if I'm wrong here. And organizational skills in order to better manage productivity and email communications in your workday. So as a manager, part of a role is to help coach and mentor staff through these milestones. So we're all committed to the same purpose. And, as a podcaster, as a consultant, I'm also trying to, in a kind of a how do I put it, a long reach, kind of be here for you as well as to the point that I can, to provide accuracy in documentation and giving you direction. And the realization is that communication between your teams helps to really build a robust picture of that patient care. And coders with enhanced communication skills advance individual success and are better able to demonstrate professional coding and clinical knowledge and expertise and credibility in your healthcare field. And this is how you get your team to win. So we're going to brush up on our communication skills. And here are the 10 tips I want to give you for doing that and to make sure that you are a better communication person and in your skills. So first of all, let's look at message and tone. Number one, communicate in a professional manner. Try not to use I statements all the time. You know what they say about there's no I in team. So really try to communicate more as this is what we do. This is how we will work through this, and that can be very helpful. Also, recently I saw something that said, don't apologize for being late. Say thank you for waiting for me, or thank you for your patience. Try to always start with a positive, okay? Number two, read original communications as an opinion. So somebody you may not care for what it says, but original communication is somebody basically sending you a quick statement saying, because they're having a moment as well. So you read it as an opinion. And then number three, focus on the intent of the message. Is it about the clinical documentation? In other words, don't take it personally. I see that happen quite a bit. And you can't take it personally. You don't know tone. I was recently auditing some records, and I got some email correspondence of a back and forth between a provider and a coder. And I was just appalled at the lack of respect between both parties. And unfortunately, it was mostly the coder, and I couldn't tell if it was the tone of the email or if it was just the lack of respect or trying to, be a know-it-all from both of the coder and the physician. And so this is not a black and white arena, as we know. If it was, you wouldn't need help. You basically just pick up the book, code it as it says, and move on. But there's a lot of interpretive information. So when you get a message, whether it be through email, through text, even verbally from somebody, really figure out what is the intent. Do not take it personally. Now that brings us to number 4. Responses should be a reflection of clinical documentation and not personal opinions. So you can give a personal opinion in your head, or you can talk to somebody outside the arena of what you're doing obviously without a HIPAA violation. But when you're responding back to a message or something, maybe even a query into what you did, make sure that you are just giving that response back from a professional clinical documentation and rule standpoint. And then number 5, to better explain coding rationale, utilize chart documentation with coding clinics guidelines. So with the AHA, with CPT, with your specialty, if you're cardiology, be ACC, if you're orthopedic, be AAOS, and so on. You want to make sure, even primary care, AAFP, which I'm a consultant for, you want to make sure that you have enough backup behind you when you're trying to rationalize what it is that you're providing. That's why with my Coding Corner clients who tried to call me for information, I said, you have to email because I want a paper trail. First of all, if I don't off the top of my head know the answer, I want to make sure what answer I'm giving you as well is not only the rationale for my opinion that isn't a professional opinion, but it's a reflection of guidelines that I can say this is why. It's not just Terry's opinion. It's because the AHA chapter 12, quarter 3 said to do this. Number 6, indifference will occur. Okay, when this occurs, there's a likelihood of a physician query, and that is going to be required to clarify the clinical documentation and to come to an agreement. It's not an agree to disagree. We can't do that in clinical documentation integrity, but we can basically come to an agreement that we can both live with. How about that? So when it comes to coding guidelines and documentation effort, indifference will occur, especially with the new 2021 E&M guidelines. There's just no question there. Timely email responses. Okay, so now we're going to get into number 7, or at a minimum, acknowledgement. Nothing drives me more crazy, and I'm sure this also drives some of you crazy, is when you send an email or you think you've handled something and then you don't get anything back. It's already off your desk, and then a week or 2 later, you're like, oh, shoot, whatever happened to that? And then that person didn't follow up. So number 7 is choosing particular times to review and respond to emails, and do not go days without responding. One of the things I have in I bring up my membership service because we're just getting all kinds of members right now, and it's really a successful thing if you're a coder and a biller or an administrator and you need help. You want to make sure that I give 24 hours. I always respond within 24 hours, usually sooner. But you want to have particular times to review and respond. So you say, okay, in the morning, you're going to do it between this and this time, before or after lunch, or at the end of the day. And make sure it's not all day long. It can't be all day long, or you'll never get any work done. It'd be like sitting on Facebook or sitting on Instagram all day long. I mean, how many times do you sit there at night, you're winding down, and this is a bad way to wind down, I do it myself, and you kind of look up your Instagram and you're looking at things, and all of a sudden you look up, and when you thought you sat down at 6 o'clock at night, all of a sudden at 7:30, and your husband's sitting there going, well, I'm glad you had a good day talking to me. So it's just, you want to make sure that you have particular times to review and respond, and don't go days without responding. Number 8, and again, it's going to still be with this timely responses and minimum acknowledgement. Choose to review emails in half-hour to hour increments based on coding workflow to email volumes. So you want to make sure that, again, you are, first it's choosing times to review and respond, but you don't want to spend your whole day at it. So try to review in half-hour to hour increments. That's it. Then get back to work, and you'll get back to the email eventually. So at the specific time that you have calendared, make sure you've got that organizational skill there. And then number 8, so that was number 8. Number 9, you should not be able to respond within, should you not be able to respond within a 24-hour period, which I mentioned. At least provide an acknowledgement to the person who sent you the email. Just give a brief note with a response time they can expect, and stick to it, and then save that as unread so that you can go back to it when you are responding and you have the time to look up the information and respond back to that person. Just to leave it there and say, okay, I'll get to it. I get that a lot. For example, I sell certain products on my website, like books and things like that, but sometimes we're in the middle of updating them. And so I always respond back, because I get a quick email when somebody purchases something and say, you know what, thank you for your purchase. We are updating this at this time, and we hope to send out your publication within the next 10 days. Would you care to continue that, or would you like a refund? And everybody just says, no, I'll wait for it. But the thing is that at least they got an acknowledgement. They didn't think their email went into some, cloud system that nobody ever saw, or into my spam folder. So it's really important that you respond within a 24-hour allotment time, or provide an acknowledgement, even at a minimum, of when you'll get back to that person. And then number 10, should the email volume become overwhelming for you? And I know a lot of us have that. It just, they always say, if you want to get something done, give it to the busiest person. But if it becomes overwhelming, seek out advice from others or a manager to better handle the situation. Maybe they can split it up, and nobody knows if you're overwhelmed unless you tell them. And try not to think that that's going to be a reflection that you can't do your job. We all really want to be able to handle our workload, but once it gets too much, then it starts to be a problem as far as efficiency. I know I give a lot of sports analogies, but I was just looking at a recent baseball player, because there's a push for the playoffs right now. And he's a what they call a utility player. He does everything. He plays shortstop. He plays outfield. They brought him into pitch one time when the game got away. But he's not good at one thing. He's not, I shouldn't say he's not an expert at one position. He just does everything. So he's good, but that's why he floats around from team to team, because he hasn't told anybody, look, this is overwhelming. Can we just focus on this one so I can be an expert at this and get my job done. So really make sure you're giving that information to your administrator, to your manager, to your supervisor if you need to. And I would present it as not as I can't handle this, just I need some help managing this email. It's actually getting overwhelming at this point because I'm also trying to keep up with my coding and billing, et cetera, and my follow-up. So make sure that you're putting it in a way that reflects that you still want to be able to handle it. You just need some assistance within that handling it. And just to, bottom line, we all like to receive timely responses to our email communications. So make sure you're professional, you're courteous, and being a good communicator will automatically lead you to much quicker outcomes and better relationships. And responding quickly can actually increase productivity by closing the communication feedback loop and allowing coders and managers to resist, stopping or stagnation while they're waiting for a response. So make sure that you are communicating effectively on the job, and that hopefully these tips have helped you really to do that. So your message tone and your timely responses and the top 10 within that is going to be important. Okay, so we want to get into our coding question today, but first, our coding question is brought to you today by Medisoft Cloud. Medisoft is a cloud-based medical billing system that is a fast and highly scalable platform that transforms the way healthcare providers manage revenue cycle management. Visit medisoft247.com today for a free trial. Okay, so I have an interesting one for our coding question. It's more of a compliance question, in my opinion. But somebody was saying, hey, we're getting these requests for signatures on our medical records and our claims, and we're not sure why they would ask that since we are all EMR and electronic health record based. Well, this comes from a couple of the MAC payers, and I've pulled some information on this. And let me just give you kind of a lesson, if you will, on how Medicare defines handwritten and electronic signatures. So Medicare requires that all services provided or ordered be authenticated, is what they called, by the author of the medical record. Okay, so the appropriate method used for authenticating is either a handwritten or electronic signature. Believe it or not, some practices still have paper charts. So here's some examples of medical records requiring a signature, and this is something that is right in a lot of the local coverage determinations. Dictated reports, outpatient visits, lab diagnostic orders and requisitions, certificates of medical necessity, treatment plans, plan of cares, treatment log notes, initial evaluations, current reevaluations, so that means our E&M services, and then in and outpatient office visits. So handwritten signatures is defined as Medicare says a handwritten signature is a mark or sign by an individual on a document to signify knowledge, approval, acceptance, or obligation. Okay. Electronic signature, Medicare also has specific guidelines for that, and it says the systems and software your office uses must be protected against modification. So once it's signed, it can't be deleted, it can't be changed. Your administrative safeguards should follow standards and follow the standards of practice and laws. You want to teach your office that whoever's name is on the alternative signature method and the provider are taking responsibility that they attest to the info and that it's true. So I've seen a couple physicians where they get an audit request or something that says, well, I didn't sign that. And it's in the electronic health record as their signature there and the counter signature of, let's say, a mid-level. So if you're using electronic means, which most of us are now, you don't have that out. You can't say, well, I didn't know that. That is your signature. And when you authenticate it and allow it to be used, then that's saying that you agree with everything above. So it's really important that you also review what's being added into your record. And then if ever questioned, you want to include a copy of your office's electronic signature protocol. I've had MAC carriers ask for that. So the reason that they ask is if it's paper chart, obviously the illegible signatures. I haven't had to deal with that too much lately. But you also want to have the signature log or something that from an electronic standpoint, you need to have a protocol. So that's how you handle your signatures and making sure that you have something that says this is how we do it. Otherwise, they'll ask for money back. And where you're going to find an audit for this, under the TPE audits. That's the targeted probe audit and education audits, where they're focusing on one thing, usually little mistakes. And so you want to just keep that in mind that that does happen. So my personal tidbit this week might be a little bit of a left turn, but I just wanted to put something out there to everyone. There's a lot of frustration and things that are happening right now, not just politically, but with COVID and everything going on. One thing I would really appreciate everyone to try and do is we are all frustrated with what's happening in the world. Obviously, we all have COVID fatigue, and the politics is just overwhelming. And without getting into a discussion about that, if you're somebody that needs to vent, or if you have somebody in your life that needs to vent, and I'm one of those people, I need to vent. And so it is really important that you let somebody do that in the personal confines of your house. Try not to judge, just listen, just let somebody vent, because when we get it off our chest, even if you get stink eye from somebody, it actually just helps us regroup, and we're hearing what we're saying out loud. And so that's why I wanted to put it out there, because, oh my gosh, my poor husband, when I get frustrated, I need him to just listen. I just need him to listen. And believe it or not, even though we're both conservatives politically, we don't agree on, I would say, 50% of what's happening in the world, which is really tough to be married to. And I'm sure he feels the same way. So it's just important to let people vent. And when I say in the privacy, where they're not worried that somebody's going to record it, post it, or use it against them if they feel what they feel. So it's really important that you give somebody a chance, whether it be your kids, your spouse, your partner, your sister, whoever. Try to give everybody a chance just to vent and call it their safe place. It makes a big difference, especially with mental health. Just it really giving us a chance to just get it out there. And then all of a sudden you're like, okay, now I can take a breath and move on and hopefully control what I can control. And things that you can't, you just have to move on from. So I'm just going to kind of challenge you to try and do that. Even if you know what that person's going to complain about or vent about, try to show them some grace and just let them do it. Sometimes at the end of the day, we all just need somebody to listen and at least acknowledge our existence. So just something I'm putting out there, and hopefully everyone just really kind of embraces that. So we're going to make it a great day, make it a great week, and I will talk to you next time on the Codecast podcast.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter at TerryCoder1, or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.